Hey guys, happy Tuesday. Time for Tidbit Tuesdays. So I've been talking the last few weeks. I've mentioned about being careful when you go to the doctor, asking questions. Had another call this week with someone that went to the doctor for a second opinion because they didn't like the experience they had with the original doctor they went to go see. And they didn't have a good experience at this place either. So the first place they went to, they did a physical, did labs, and then no one called about the lab results. And he received a message just saying, "We've called the medications for you, you have high cholesterol," without reviewing his labs with him. Crazy. So didn't have that warm and fuzzy feeling, didn't think that was really just great to do things that way. Then went to a different practice, and he had confirmed with his insurance that another wellness visit would be covered. Of course, it depends on how they bill it. My insurance doesn't tell you that. But as he gets off the phone with the insurance, while he's in the waiting room, the doctor walks in, shaking her head and saying, "No, it's not going to be covered." And he said, "Okay, I'm out of here." And instead of letting him leave, the doctor started asking him questions, and he felt compelled to answer questions. And then they billed all this stuff to insurance and try to write more scripts for him. Again, not a warm and fuzzy feeling. One, as I've mentioned before, if you're ever uncomfortable, you need to just tell them to stop and tell them you want to end the appointment or don't have the appointment. I think people were trained to really trust doctors, which is not a bad thing, but I think sometimes certain practices are just trying to get through patients. They're not giving the attention to the patient. They're not asking all the right questions. They're not being thorough. And certainly not thorough if they're not going to review results for you. That is bizarre to me. I ran medical practices. That would have never happened in any of the practices I worked at. Patients would either gotten to talk to a doctor on the phone to review results. If the patient was okay, a nurse would have done it, or they would have come back into the office and had another appointment so that the doctor can discuss things. And I really feel like that's what should happen when you're putting someone on medication they've never been on before. "Oh, hello, you have high blood pressure," or "Hello, you have high cholesterol." You just don't write them a script and not take the time to go over that, ask them about their diet. The patient was like, "They didn't even ask me what I eat or what my lifestyle is." Another red flag. If the doctor doesn't ask you what you eat and if you exercise, that's a problem, because what you put in your body and how you treat your body is definitely a factor on your health. Just like giving you a medication can reduce things, and it's having a conversation to make sure that medication is the right course for you. Or, some people want to be on a medication. Some people, like myself, prefer not to be on medication. And if something is wrong or labs results are skewed, it's like, okay, why did this happen? What can I do differently? And if it's not urgent, I'm not going to die tomorrow if I don't take a cholesterol pill or if I don't take a blood pressure pill, then let's try something that's better for me than taking a medication. And so this poor gentleman was just so frustrated. Now, twice he's been and have not gotten a very good consultation, which is why I use a concierge doctor. There are some really great doctors out there, but this guy just happened to get just two that he just didn't have a good experience. So maybe get referrals from a friend or family who have had an experience with a doctor. Hopefully they're in your network, that you can utilize them. Knowing what's important to you and how the practice treats you is super important. For me, it's more important to me to be able to message my doctor, have a conversation with my doctor, than being led through like fast food medicine where they're just trying to do volume. So Keep in mind, you're not required to stay for a visit if you're uncomfortable. You certainly don't want them billing for something if you don't even want the appointment. But if they start asking questions and making notes, then that counts as an appointment, and that's why they billed it. But again, this poor gentleman felt pressured, and I never want anyone to feel that way. And I guess because I work for doctors, they don't intimidate me. And I get why some people are intimidated by doctors, but overcoming that fear is really in your best interest and in your best health. Until next week, peace out.